A bill that makes big changes to Medicaid has cleared a major hurdle in Congress. The Energy and Commerce Committee passed the measure on a party line vote after a tense 26-hour hearing. It's a key part of the Republican spending plan. Your political reporter Sean Boyd has been tracking the changes. So Sean, what does this mean for Colorado?
Well, according to the nonpartisan Congressional Budget Office, this is new data that they just put out, 100,000 Coloradans would lose their Medicaid coverage under the bill due to new work requirements. While Medicaid spending would continue to grow under the bill, it would grow by about $700 billion less over the next decade.
Everybody, that is not rich.
Protesters in wheelchairs gathered outside the committee hearing, begging lawmakers to spare Medicaid as they cut billions in federal spending.
It honestly breaks my heart, the fear-mongering that's occurring in this place.
Congressman Gabe Evans sits on the committee and voted for the bill that he says will protect Medicaid for those who need it most by purging the rolls of those who aren't eligible.
I voted to keep 1.4 million illegal immigrants from cutting in line and taking taxpayer money away from disabled peoples and from pregnant women and from kids. I voted to clean up our Medicaid rolls and keep 1.2 million people who aren't eligible for the program from cutting in line and taking money away from those who need it most.
The most controversial provision in the bill, so-called community engagement requirements. Able-bodied recipients without kids would have to prove they are working, volunteering, or going to school 80 hours a month.
Asking people to receive taxpayer-funded health care by being engaged with their community for 20 hours a week, I think that's a very reasonable request.
We need to realize that individuals may not be working because they just lost their jobs and they're in transition. And that period of transition can vary depending on where we are in the economy. Right?
Kim Bimsteffer runs the state department that administers Medicaid, which covers health care for 1 in 4 Coloradans. The agency estimates half of them are already working. If they have to verify their work status every month, Bimsteffer says it would mean a new $57 million administrative burden based on other states' experience. Evans says the money they would save from removing ineligible participants would help cover that cost. Bimsteffer says thousands will end up uninsured, driving up costs for everyone.
If they cut monies that we cannot backfill, we have to begin to cut some way, shape, or form across Medicaid, and that will have an impact to families, to providers, to our economy, and all Coloradans as those costs need to shift that aren't covered.
The bill also includes new cost-sharing requirements for people at or near the poverty line and requires states to verify a person's eligibility twice a year instead of once a year. Bimsteffer says they already run quarterly income checks through the Department of Labor and Employment, but a full eligibility review would be another expensive and, she says, unnecessary administrative burden. The bill could also cost Colorado tens of millions of dollars due to a provision that cuts federal funding by 10% to states that provide Medicaid for non-citizens. In Colorado, the state is expected to spend about $51 million this year on Medicaid for 18,000 non-citizens. This is a first step in a long series of steps before this bill would become law. It needs to go through 2 more committees before it hits the House floor and then goes through that same process in the Senate. And then if there are differences between the House and the Senate, it'll need to go to a committee to work those out. The provisions in this bill, most of them would not take effect until 2029.
All right, John, thank you.